Hello, everyone. Welcome back to the Manatee County Your Choice Wellness Wave. I'm your host, Dan Trongone. I'm the Fitness and Wellness Coordinator. And in studio with me is Miss Claribel Gill. Say hi, Claribel. Tell them who you are.
Hi, I'm Claribel Gill, lamp therapist.
And we also have another special guest, Mr. Marcus Harris. Introduce yourself and tell them what you do.
Hey, everybody. This is Marcus Harris, and I am the Diabetes Nutrition and Education Specialist.
Awesome. So we have a full house as we did last time. So this month is going to be a little special. So it's June, but we're going to specifically talk about men's health. Actually, it's all pretty much everybody's health, but we're going to have a special little section where we talk about specifically gearing towards men. But we're going to kick it off with Miss Claribel. Miss Claribel, what do you have for us today regarding maybe either men's health or just in the mental health space?
Okay, so then I'm gonna talk today about men's mental health, and according to the American Psychological Association, mental health statistics reveal that while the significant portion of men experience mental health challenge like depression and anxiety, they are less likely than women to seek for treatment.
Really?
Yes. Additional, men may face unique challenges in assessing mental health care due to society expectation. It's a stigma around masculinity.
Okay. So masculinity. Okay. So real quick, what have you seen? So now we kind of know what the stat kind of says. Like, have you seen a lot of men, and again, please don't be specific, just like what you've seen in your therapy sessions here, do you feel like that's pretty accurate statement, or do you feel that's not as accurate?
It is pretty accurate statement. Basically, when I see men in the office, they kind of like on the first day, the first thing that they said to me is like, I thought about it so many times about coming to see you. I'm so never talked to anyone about my mental health and what I'm going through right now. And for them, the first time is really hard to express themselves to whatever situation they're going through at the moment, because growing up, this is what they not have in their head. Like, men's not supposed to be depressed, men is not supposed to have any anxiety or going through any stress level in their mind. So therefore, it's hard for them to express themselves.
So, Claribel, let me ask you this. What's the order of this situation? Do people get anxiety first and then it turns into depression? Or is it, hey, I'm depressed, and then it turns into anxiety? Like, when should somebody try to catch that?
Well, a lot of the time, depression is a different diagnosis than anxiety, okay? Depression is, like I always says, there's a 3 types of diagnosis for depression, which is one is like you grew up with something that happened in your life and you were not able to cope with anything that with that situation that happened in your life. Another one is situational depression. Situational depression means that when you go through a divorce process, your separation or moving to another state, that's what we call situational depression, because you're not able to cope with that, the process you're going through at that moment. And depression, the other one is a chemical imbalance, that when we said, growing up with that, like you were being depressed, you didn't know why you were sad, you don't know why you feel like no motivation, like isolating yourself. That is what we call chemical imbalance in your brain. And that's when we said you need medication. For anxiety, is different. It's a different diagnosis.
So is anxiety more like cyclical? Maybe it comes in waves, and depression's like, hey, like you're in it till you fix it. Like, how would you describe it? Simple terms.
In simple terms, would be depression will be like you talk about it, whatever happened in your life, and with medication, it gets yourself in a better place, right? So it's good. Long term. For anxiety, it's different. So anxiety, like if you learn some coping skills and how to deal with anxiety, you can get better. But the problem will be when you get panic attack from the anxiety.
And that's worse.
And that's worse. You get panic attack from the anxiety, and then that means that you might need medication in order for you to get yourself in a better place. For the anxiety, it's a lot of the people, they are able to manage the anxiety, but a lot of them, it's really hard for them to manage the anxiety. Therefore, the second choice that they have is taking medication to help themselves.
Gotcha. So, Claribel, since we're talking about Men's Health Month and screenings, do you have like an anxiety screening that you would recommend? Like, I know Aetna has some stuff and I have some things, but like, do you use your own kind of screening? Like, I know Aetna has like, hey, if you're possibly battling anxiety, maybe get routinely checked if you're 18 and up. That's from the Aetna website, but what do you think is a good screening recommendation?
So there is 2 screening for anxiety. There's back depression inventory. for the anxiety's back anxiety inventory, and there's another one for depression, which back depression inventory. So which means that both of the screening will give you an idea like where you at based on the information in question that it asks on the questionnaire. And that's where we decide how high or how middle or how low is your anxiety or your depression. Let me tell you a little bit about a lot of statistics about men. Approximately 1 in 10 men experience depression and anxiety, but less than half of them seek for treatment.
So 10% of the male population have depression.
Mm-hmm. But only half seek for treatment. That is really sad, like seeing that happen. And that is according to American Psychological Association that I found that information.
Wow.
Men are less likely to seek for mental health help, possibly due to cultural norms and discourage emotional expression, help seeking help.
Okay, so I know we have a screening here that says, if you're depressed, adults 18 and up, including women, should get regularly checked. But what does that mean regularly? Let me ask you this. If I come to you and I go, hey, Claribel, I feel like I'm depressed, and you go, yeah, you are, how often should you check in with me?
So usually what happens with depression, I usually check with member every week, once a week.
Okay.
Once a week. Because like the first time that I do assessment, let's say for depression or anxiety, I ask a lot of questions about how it is that you feel, like lack of motivation, like you're not able to do anything. Then they think about what happened on the first day of the visit. Then for the next time, they're going to get more open at ease at themselves why they were going through that diagnosis.
Awesome. Well, thank you so much, Claribel. This is actually very useful, especially for men, like you said. What was that stat? 1 in 10 men are depressed, and then half of them actually go seek treatment.
Mm-hmm.
Oh, man. I hope those men in this audience, all 6 listeners, can't be wrong. Listen to what Claribel said, right? Remember, she's the mental therapist space. This is her, realm. And again, right, the mind leads the body. So, Claribel, how can somebody find you if they are maybe dealing with anxiety, depression?
So you can go to Manatee, your choice, and you're going to find all the information for LAMP. And you can schedule or send me an email. You can also call at 941-741-2995 to schedule your appointment.
Awesome. High five all around me. Thank you so much. You were wonderful. I appreciate it. All right, everybody. So I hope you listen to Miss Claribel Gill. Now, we're going to shift gears a little bit. We're going to start talking to Mr. Marcus Harris, who's not only our registered dietitian, health nutrition person regarding food, he's also our diabetes educator. Marcus, how you doing, sir?
I am doing great, Dan. Thank you. I am so excited to be here. Let's do this.
That's it, man. Happy June. Happy Men's Awareness. So, Marcus, let's just talk about, again, your space, right? You're Mr. Food and Diabetes. Now, I know Aetna has a diabetes screening, but how do you like to put it in super simple terms if you're just talking to an average guy that might or might not have diabetes?
Yeah, I mean, even having diabetes or just anything for that matter, I feel that, in our 20s, we worry about, picking the best people to hang out with and lowering our risk factors for doing, boy goofy stuff, right?
I'm the head of that.
And then in our 30s, we kind of transition and we start thinking about picking up healthy habits and getting their routine checks. And by the age 40s, in our 40s, Dan, we really start to really look at the body and its changes and kind of what naturally happens with life. And then 50 plus, it's just hey, let's make sure that we are taking care of ourselves, picking up anything that we haven't done beforehand, and let's start getting ourselves in order and getting routine checkups. So,
oh my gosh, man, that's totally me. I just turned 48. I'm like, my brain says I'm 25, but my body's like, hey, you need to head to Denny's.
Yeah.
Totally agree. So, okay, Marcus, so why don't you give us some maybe kind of things that you look for as far as if you were going to do a diabetes screening, in simple terms for the average listener?
Yeah, so the diabetes screening begins with just looking at the criteria. So
okay,
a lot of things that put people at risk starts with age. The number has declined. Now, it used to be age 40 we start the screen for diabetes, but now it actually begins at the age of 35.
So you're saying as you get older, screen more and more frequently?
Exactly.
Okay.
Exactly. So we know that at 35, we're going to start screening for diabetes. And also, if you were a male and let's just say our weight is in the obese category from the BMI,
sure,
that's another thing that we kind of look at for looking at your risk factors for diabetes.
And people, real quick, so BMI is body mass index. That's a height relative to weight index to see how, A, what kind of shape you are, but B, how much fat mass to overall height and weight you might have. I'm going to go talk to that in a little bit. But Marcus, real quick, what exactly is diabetes to the average listener if they don't know what that exactly is?
Yeah, so diabetes is essentially something that happens within the body. So our pancreas is responsible for producing insulin. Insulin's job is to go into the bloodstream and remove sugar from the bloodstream into your muscles, keeping you with a relatively normal blood sugar level. Now, what happens in case with diabetes is that our body function is dysfunctional in the sense that our bodies does not respond and our mechanisms in our body does not lower our blood sugars in the proper way, in normal way.
So, Marcus, if they see you and you go, hey, I'm detecting diabetes, but they don't do something about it, what are some potential negatives to somebody's body if they don't listen to your advice?
That is a great question, Dan. My very first line when I am doing a diabetes education course is to tell people that you can live a long, thriving life with diabetes, okay? And the biggest thing is that, people living with diabetes is it's not diabetes that really complicates things. It's uncontrolled diabetes that complicates things. Exactly. So as long as you have the power, and I tell people that you have the power, you have the ability to treat your body in the way that you decide to. So catching it early and actually doing those screenings is going to be huge.
I totally agree with you. So Marcus, if you were, I know Aetna, we have an Aetna screening that says, regular adults 18 and older, including women that are pregnant or postpartum. How do you have your own kind of metric that you like to check for diabetes? Is it once every 6 months, once every year, or maybe, since you're really into this, do you do it bi-monthly? How do you check?
So I think, in my personal, it's going to be really, what did you grow up with? So when I was in the military, I was mandatory for me to go to all of my medical appointments because we were property of the government, right? So they're going to make sure that they take care of you and make sure that there's nothing underlying that they don't know about. Now, when you transition out of the military, I was fortunate enough to keep health insurance, so I would go annually. So if you can, you should get your checkups and screenings done for your cholesterol levels, your blood pressure readings, and then obviously your A1C, which would determine if you have diabetes. You should get those done annually, on an annual basis.
And I totally agree with you. I think a lot of men, including me, right? I'm a health practitioner myself, but I know my dad, and genetic for me, he naturally has high cholesterol, and my dad eats a ton of fruit, ton of vegetables, super active, but that's a genetic component. So I agree. I know Aetna here has a screening that says try to get it every 5 years after the age of 35, but unlike you, that's why it's called an annual physical, right? The more whatever gets monitored gets managed. So if you're monitoring it very frequently, you can attack the issue. Okay, so cholesterol, everybody, and this is also in Marcus's space because what you eat and how you exercise can also determine what's in your body. So cholesterol is a ratio of what's called good cholesterol and bad cholesterol, these molecules that help make your hormones up, but out of control, they can actually clog your arteries and promote negative effects such as either stroke or heart attack. So Marcus, you were before talking about body mass index. Let's relate it to your space. So body mass index, like I said, is a height and weight issue, right? For how tall you are, you should weigh this. So if somebody has a high BMI, right, body mass index, what is that in relation to diabetes? So if I have high BMI, does that mean that I have a higher risk of diabetes, or does that mean I have a low risk of diabetes?
So great question, Dan. So if you have BMI, that is going to mean that you have actually high risk for having diabetes. Now, that's not the end all be all. Let's keep in mind that BMI is one of those baseline tools that we use. It's just a tool. So are there some outliers? Absolutely. I am a bodybuilder, right? So therefore, in the progress season, progress seasons mean that we can carry a little bit more weight. Technically, I'd be overweight.
Right, me too. Right there.
I would be overweight, but I am a person who exercise every day. I eat. So it's not about technically your overall BMI is the end all be all, but
totally agree.
You combine BMI with what you're currently doing, and that's how you determine the overall conditioning of a person.
Exactly, because I'm like you too, right? I'm a regular exerciser. I've been lifting weights for 30 years, walking, running, not running anymore, but more walking, sleeping, but let me ask you this. I know that Aetna has an obesity counseling thing where they talk about BMI, but I'm personally, just as a side note, I'm more like a body fat person. Just because like you, right? You're super lean, But again, if the doctor didn't look at Marcus or Dan and go, hey, Marcus is 5'10", 195 pounds, they would say, hey, Marcus is a sick person. But then they look at you, you're super lean, you're super strong. So that's why I'm glad people get checked to the BMI, but I'm more of a body fat person to see functionality.
I'm going to double down on that, Dan. I'm going to say that not only just is just BMI, you can take that information and actually use it as a tool, but maybe a more definitive tool to use for sickness or how well you're doing would be your waist circumference. So again, we don't get to make the rules, Dan. We just spit the facts, and the facts are that friends. If you are 40 and under for your inches for your waistline, and that's 40 under for your waistline, we're talking about getting a measuring tape and going right over your belly button and wrapping it around. For men, the research says 40 inches or less put you at a decreased risk. Correct. Gotcha. And for females, it's 35 inches or less will put them at decreased risk for having, diabetes and other preventable chronic diseases. So you could take that one to the bank. 40 inches and under if you're a guy, and then 35 inches and under if you are a female.
I love it, Marcus. I like it because think about it, right? Obesity and physical fitness are very related. The more obese you are, you probably are less physically active. And the less physically active, you're not going to hit those numbers you just said.
Exactly.
Right? So again, just real quick, BMI, according to Aetna, body mass index of 30 or higher is considered obese, right? There's various outlets from American College of Sports Medicine. We have NASM. This is National College of Sports Medicine. We have NSCA. But again, if your BMI is high, like I said, according to Aetna, 30 or higher, or like what Marcus said, which is more useful, if your clothes are fitting tighter and you're hitting that 40-inch mark, you're approaching to obesity. But like Marcus said, the more body fat tissue you have, there's a higher risk of diabetes. There's also a higher risk, right, Marcus, of high blood pressure because there's more weight on you. So we're going to shift gears a little bit, folks. We're going to start talking now, and Marcus is going to chime in too, because we're going to start talking about physical fitness, okay? So with physical fitness, we're going to also talk about how Aetna has a screening tool, which you should get checked for men and women, again, regarding bone density. So this is Marcus and I's jam. So I know Marcus and myself, people who are regular exercises, and we're not just talking cardiovascular, we're not just talking yoga or daily activities. We're talking about good old-fashioned brute strength horsepower. Okay, regarding bones, your bones literally get super dense and turn into cement within reason. So God forbid you slip or fall, you have a less risk of injury or fracture. Okay, so if you do have a low bone mineral density, I highly recommend, if you're a man or a woman, to definitely get that checked out, because now two of the most disturbing statistics in my world, and Marcus, feel free to chime in, is from Dr. Peter Attia, who's a full-blown medical family practitioner, but he's one of the leading exercise researchers on the planet, along with Dr. Ed Laskowski from the Mayo Clinic. Okay, so I'm going to read you some stats. So, talking about biomarkers of longevity. Biomarkers are indicators of how well and how long you would live. Now, mortality means death rate, right? We're going to talk about mortality. So let's say you have a lot of body weight, that you have a high BMI, you don't regularly exercise, and you're not listening to Marcus as far as eating right. Let's say you have a high blood pressure issue. So a normal reading is under 120. That's called your systolic, when your heart is beating, right? That's the blood pressure at beating. Then your diastolic is your heart at rest. That's the pressure in your blood when your heart's at rest. So anything under 120 or under 80 is good. But if you're over that, do you know you have a 20% risk of mortality just from high blood pressure? Isn't that crazy?
Wow.
Isn't that nuts?
Yeah.
So check this out. Marcus's space. Let's say you go see Marcus and he goes, hey, I now know you have diabetes. Marcus, what do you think the decrease in mortality is?
I'm going to take a wild guess out here. I'm going to say, I'm going to jump out there and say 30%.
That's it, man. You right on the head, right? If somebody has diabetes and they don't do anything about it, their mortality rate increased by 30%, or their longevity decreased, right? They're opposite ends of the spectrum. Okay, Claribel, this is more of a mental space. Let's get Claribel back in here because she's our mental therapist. So Claribel, right? A lot of people see a mental therapist if they deal with smoking, correct? Okay, let's get your thoughts. What do you think the mortality rate for someone who smokes?
Let's say about 20%.
Okay, you ready for this? Their longevity decreases by 50%, or their mortality increases by 50% from smoking. Isn't that nuts?
Wow.
Oh my God.
Wow.
Crazy. That is very high, right?
Yes.
Okay, you get ready for this? This is now MySpace, not the social media platform from 20 years ago. This is Dan's realm, the physical fitness. The two most important factors that identify somebody's ability to have a nice, long, healthy life, or if they don't do this, they have a huge increase in mortality, is strength and cardiovascular health. So here's a stat from Dr. Peter Attia. If you are weak, meaning you don't weight train at all, you just let the natural age effects of life happen to you, you have a 250% decrease in longevity or 250% increase in mortality just from being a weak individual.
Wow.
And then that's so Marcus.
My.
Right, isn't that crazy? So Marcus, in your space, if you see somebody who's coming to see you with dietitian stuff, but they're a very muscular person, I like to think that's good in your world.
100%, Dan. If you have muscle is your friend. Like fats are your friend. The more muscle you have, the more metabolically active you're going to be, and the more rejuvenation your body's going to have on a daily average. It all just works for the good.
Oh, 100%. Now, this is the craziest stat I've ever heard from Dr. Peter Attia. So if somebody doesn't do any cardiovascular exercise, this is recorded by Dr. Peter Attia doing what's called a VO2 max test. That's a ventilatory oxygen test. Somebody who has a very low capacity for heart and lung function, your mortality rate, again, mortality means death rate, goes up by 400%. Or your longevity decreases by 400%. Isn't that nuts? So the two things that a lot of people don't deal with that have the biggest bang for your buck is strength training and cardiovascular exercise. Isn't that nuts?
Well, it's shocking when you see it on the paper, but when you look at it in reality and you look at the wild, the person the animal that gets the brunt of everything is the slowest one, the one that doesn't roll with the pack. So doesn't have the physical fitness to get away, Dan.
Exactly right. So Claribel, let's talk about your space real quick before we wrap up. If you see a man or a woman, in this case, we're talking about men because it's June, when you have a man that is very physically fit all around, right? They talk to Marcus with nutrition, they're weight training, they're exercising, they have a healthy lifestyle. Do you think you see them a lot from a depression and anxiety standpoint, or are they kind of more of like the outliers where like you maybe check on them once in a while?
You know what? I just have someone like that, and I was so proud of him telling me that the way how he gets his depression under control, it's by him doing exercise. This is what he just said. I go to the gym at least 5 times a week. And he goes like, when I feel that I getting myself to a point where lack of motivation or feel that I don't want to talk to anyone, so I know that the pressure is coming to me. So what I do, I get up and go to the gym and start doing exercise. And then my mood start changing. When that happens, it makes me really happy because at least they're doing something for themselves. So with that being said, with those people doing something for themselves to get themselves better, I don't schedule them to come at least once a week. I do let's do check-in once a month. Let's see how things is going for you. It's your depression under control. Are you doing your exercise? Are you doing your diet? How is life going for you? It's just to talk about anything that is happening in their life and how they can get themselves feeling better about themselves.
Because they're doing the work.
They're doing the work.
That's it. Mm-hmm. That's it. I love it. Well, thank you so much, everybody. So real quick, you have Claribel Gill with Miss Claribel Gill, for mental therapy. You have Mr. Marcus Harris for nutrition and diabetes education. You also have me, Dan, the fitness wellness educator. So we are all found on manateeyourchoice.com. Everybody who is on the health plan has 5 free. You can see Marcus and his registered dietitians 5 times a year for free. You can see my trainers 5 free sessions of exercise therapy a year for free. You can see Miss Claribel Gill for 5 mental therapy sessions a year for free. Also, we have health coaches, which you get 5 free of them, which is like a life coach. And then now we're introducing the Symmetry Align Smart, which is me, Dan Trongone, to align the posture. And that's additional physical / health educational movement therapy. So if you feel you are dealing with any of these things that Claribel or Marcus or myself talked about, please go to manateeyourchoice.com and schedule one of your 5 free this year. Thank you so much, everybody. Have a wonderful day. See you next time.